Hi, welcome to the Valerie Gehy Health Insurance Podcast. And today on episode 2, we are going to discuss the key terms in health insurance. And also we are the common use of the term and different type of health insurance. Now, the key terms are premiums, how much you are going to pay every month. Um, and also we are going to discuss deductible. We are going to discuss maximum out of pocket. We are going to discuss co-insurance. We are going to discuss co-pay. What is the difference? And also the common use of it and explain also the different type of health insurance. So let's start with premium. Premium is how much you're gonna pay every month. Now, the premium when it comes to government plan, it is upon your income. Any government program, it's based on how much you make a year or what is the income for the household if you are married. So it is plays a major factors on how much you're gonna pay when it comes to income. So it fluctuates. We cannot define. There is not a one size fit all. For an example, um, a single person who make 30,000 a year will be eligible for a lower premium than a single person who makes 65,000 a year because the state subsidy varies upon the income. Now, deductible. Deductible is basically how much you are going to pay when it comes to tests beyond the preventative care. That doesn't take away that your preventative care still remain free, such as your blood work, your lab work, your mammogram, your pap smear, your blood work, your colonoscopies stay free. That doesn't take that away. The deductible kicks in when it comes to tests beyond the preventative care, such as MRI, such as if you had to go to the ER. Those are the factors that you're gonna face your deductible. Now, the co-insurance, the difference between co-insurance and co-pay. The co-insurance is a percentage of the amount that you're gonna pay, of the total amount. The co-pay, it's a fixed rate. So, for example, when the policy said you are responsible for $25 copay for any specialist, that means every time you're going to see a specialist, any specialist, whether it's a gynecologist, a dermatologist, a cardiologist, you are responsible for $25. Set, and that's it, fixed. Now, if you have to do a CT scan, you are responsible for 25%. That's where the coinsurance kicks in. It's 25% of the total cost of whatever the provider price is. So that's the difference between coinsurance and copays. Now, also, what we call the maximum out of pocket. The maximum out of pocket literally means this is the amount, how much you're gonna pay in for the whole year. You cannot pay more than that. So anytime you pay any copay, so you go to the pharmacy, your copay was $3. It is being deducted to the maximum out of pocket. Every time, let's say you have to pay that $25 to see your gynecologist. That $25 is being deducted to the maximum out of pocket. So basically, it means this is the amount for the whole year that you can come out of your pocket. So it is a cap protection. So let me explain it to you. So let's say a catastrophe hit you or rush to the ER and they have to do an open heart surgery, and that surgery is $1 million. Let's say your maximum out of pocket is 9,000. This is the max after the surgery they can bill you. So you are protected with that cap, which is that 9,000. The rest then will be the carrier will pay for it. But as of you, the consumer, you are protected with that cap of 9,000. Hypothetically, let's say your maximum out of pocket is 9,000. Now, also, when it comes to different type of health insurance. We do have the two common ground, which is the HMO and the PPO. What is the difference between those two? The HMO, it's a limited access network, which is you have to go upon where the plan takes you. And you also need a referral for any specialist you have to see. So you have to go to your primary, they provide you a referral for the specialist e-network. And the PPO, you have the largest network. You don't need a referral to see a specialist. So those are the big difference. So most of the government plan, they are HMOs. They do have the PPOs, but you already know the largest network you have, the more you're gonna come out of pocket when it comes to premium, of course. Um, Now, I always say, like, let's say you are 28 years old, you are perfectly healthy, um, and you go to see your doctor only for your preventative care. Why not the HMO? Because it is least expensive, which is one. Second, if you do have to see, it doesn't matter because you're not gonna see a specialist all the time, very frequently. So why not the HMO? But let's say you have any type of pre-existing condition, and I always highly recommend a PPO because you need different diagnose for different providers. So that's why I would highly recommend the PPOs. Now, make sure also not all the plan cover any pre-existing condition. But when we come to the ACA, the Affordable Care Act, they cover you by law. You are protected by the Supreme Court law. Any pre-existing condition, and I repeat, any. I'm talking about cancer. I'm talking about heart condition. I'm talking about pregnancy. I'm talking about hip replacement. They have to cover you by law, very similar to Medicaid. Okay, so make sure your plan cover that. Most of the two plan that cover pre-existing condition is the ACA, which is stand for the Affordable Care Act, and also any group plan from your job. Those two plan covers. But when it comes to private plan, individually separate from those two, then they are very complex. They have very hiding disclosure that may or may not cover the pre-existing condition. So that's where you need to pay attention with, because most of them, when it's private plan, it doesn't cover any pre-existing condition. So that's something you need to look into it. For an example, let's go back to the maximum out of pocket. Last year, I stepped into a glass and I had a cut on my feet. And also, when that happened, I had to go to the emergency room. So when I went to the emergency room, they had to do stitches for me. Um, did I receive a bill? Yes. Why? Because my deductible at that time was 3,800. The plan cover a part of it, but at that time my deductible was on January, so there was a brand new period. That means my deductible was up fresh. It was like literally 3,800. So did I receive a bill from the hospital? Absolutely yes. That was what I was responsible for. Now, following the year, I had to go back and do I had this pain in my stomach, and it was like a gastro. They had to do a gastro test for me. So at that time, remember, I already paid some type of my deductible. So it being deducted to the deductible. My deductible was no longer 3,800. So when I did my gastro examination, my what I was responsible for was less than the first time I went to the hospital because I already paid a good portion of that 3,800. So I think for that gastro text, I was responsible for 400 out of my pocket. Now that 400 is also being deducted to the 400. Now, when the provider said, Valerie, are we thinking of do, a gallbladder surgeries? I said, we need to do it this year. And then he said, why? It's because I almost reached my maximum out of pocket. I don't want a new period to come along. So I want to do it this year because I went to the hospital already twice for the year. So I'm almost there to reach my maximum out of pocket. So it was a good time for me to have that surgery done. So those are the trick you need to know also when it comes to maximum out of pocket. And he laughed because he understood where I'm gonna go with that. So he said, "Okay, then it's gonna happen this year." I said, "Yes." So for an example, another example, um, I had this guy when the pandemic hit, and he was affected by the pandemic, which is he had corona, but the very severe one, and he was at the hospital for 3 months. 3 months, guys, in coma. Just imagine any loved ones or you as an individual lay down fighting for your life, um, in coma. He was working at the time for a prestigious casino, and he ended up losing his benefit just because he was not unable to work for that 3 months period of time when the whole world was shut down. So you can understand the importance of health insurance. So when his fiance called, he said, Valerie, he's losing health insurance, and what we're gonna do? The man is impotent. The man is laying down fighting for his life. I said, we're gonna enroll him in a plan. So he was losing his group plan from the employer on the 30th, and I enrolled him on the first. So it there was no gap. He was enrolled immediately, so he was able to fight his life. And those are a very profound testimony for me, because 1 year after they invite me into their wedding, I was a witness to their wedding, and it was really, really emotional, to do good, to be good, to, it was, that is the profound, the dedication of my work. So it feels really good, guys, to be able to save lives. All right, so I hope you were able to learn a little bit from the podcast today. I hope the terms right now more at ease for you. And there is a difference when you are savvy, when you're talking to agent and and when you're not savvy. And on the phone, the agent can feel when they are talking to someone that is savvy, and it's challenged them. So information is power, guys. What you don't know can affect you. So when you are informed, you walk with confidence because you know the information. You grasp into the information. You can correct people. So I want you, that's the whole profound purpose of this podcast, to inform you, to educate you, for you to be informed. When you talk to an agent, you tell them, I want to make sure my doctor is in network. We have that due diligence to make sure that your doctor is in network. When you talk to a doctor, you ask, what is my coinsurance? In the agent mind, oops, that person knows his stuff. I better step it up immediately. So those are the things that we face into the industry. When you call the agent, make sure you are equipped with the information. Make sure you have the correct spelling of your doctors. Make sure you have the correct spelling of your medication, the correct milligram of your medication, because there's different tiers, guys, when it comes to medication and brand name preferred as well. So those are the things. Make sure your carriers is a prestigious carrier in the demographic that you live in. Make sure that you know what is your deductible, what you are responsible for. That's the key sentence. What is your maximum out of pocket? What is my co-insurance? What will be my premium? Those are the key question to ask your agent. I'm gonna be here every week pouring everything I know to you. So come around. Don't forget to share, subscribe, visit my website, valeriegehy.com. And also remember this, where we empowering you one policy at a time. Bye bye now. See you next week.